Hi, my name is Isamu Chang, and today I'm here to talk to you about the current pain management and opioid crisis. Currently, there is an opioid crisis in the United States. The amount of opioid-related deaths since 1999 has more than quadrupled and is now higher than deaths from illicit drugs like heroin and cocaine. For every one prescription of opioid death, there are 20 admissions to substance abuse treatments, 45 emergency department visits for non-medical use and adverse events of opioids, 156 people with substance use disorder, and 533 people using opioids non-medically. Now you're asking yourself, what as an ER nurse can I do to better prevent or better sustain this issue and treat this current epidemic of opioid use? Well, as ER nurses, you could use NSAIDs when available and prescribed. While not as strong of a pain reliever, it creates less chance for opioid addiction. And while we know NSAIDs cannot treat pain that is very severe, we must use these when possible so that we can treat mild to moderate pain. In addition, we must also go back and use these non-pharmacologic pain management techniques when applicable. ER nurses can tend to use these opioids when non-pharmacological treatments can be just as effective. Techniques like heat and cold compresses, massages, and position changes are all useful and should be done prior to the usage of opioids. In addition, ER nurses can also provide better opioid education. I believe that it is vital that the ER nurse gives education on medication. Opioids are essential to deliver these educations as they can cause issues such as addiction, respiratory distress, and overdose. ER nurses can also advocate for laws surrounding opioid use and its prescriptions from providers. They can also review the hospital policy surrounding opioid use for their patients. It is important that as an ER nurse, you brush up on the opioid use policies that your specific facility has. Ethical practice by ER nurses are to better care for a client without further creating harm. Therefore, the use of opioids, while essentially can treat that pain management, it can also create further complications down the road if the patient is at risk for opioid overuse, abuse. We must take these into considerations as well. Opioid medications are addictive and dangerous and should be utilized when prescribed, but other forms of pain management could also be implemented into a patient's care plan. Nurses have a responsibility to relieve pain and provide comfort as best possible for their client. It is the responsibility of the nurse to educate their patients with the proper warnings and adverse effects of medications and procedures. ER nurses should be aware of the potential hazards that are linked to opioid pain medications. As of 2017, federal restrictions on prescriptions for acute pain has been set to 7 days. Social justice refers to fair and equal division of resources, opportunities, and privileges to society. Therefore, a population that may be at risk for opioid use, misuse, and abuse, it is important that we, as emergency nurses, advocate for the clients at risk for opioid overdose. We must advocate for their safety. As ER nurses, it is especially important because of the prevalence that occurs in the emergency department with opioid overdose and misuse. Quality healthcare can be achieved by promoting health and not creating new health disparities and issues. The overuse of opioids has become a problem and has created an epidemic and is ruining the quality of healthcare and thus creating a mistrust from client to healthcare systems. It is especially important as ER nurses because the use of opioids in emergency services are quite prevalent with multiple traumas and opioid overdosage. We see a lot of opioids in the hospital setting. Emergency department nurses can create better quality healthcare by advocating for patient safety with opioid use, and establishing trust with patient is a critical element for quality healthcare. Thanks for tuning in. I'll see you next time.